Hello and welcome to Immaculate Dissection webinar. I am so excited that we have four of our incredible teaching team members here with us today to discuss why they chose ID, what they've gotten out of it, how they've implemented it into their practices and into their personal movement practice. And so I am so excited to introduce these incredible people. We have Dr. Monica Chadha. She's a chiropractor in Toronto. We have Lisa Burnfield, who is a physiotherapist in Toronto. We have Karin Ravalese, who is one of our treasured teaching team members in New York area. And then we also have Dr. Kris Kirby, a chiropractor in Missouri. And so welcome, welcome, folks. I thought you guys might like to hear about someone other than myself, a co-founder of ID, and that why these people chose Immaculate Dissection coursework, and why they've gravitated towards being a teaching team member for us because they're so passionate about the work. So who would like to go first? Just give me a wave and I'll pin you. Yeah, let's bring about the amazing Lisa. We'll pin her video. Lisa, tell us what you like about ID and why you chose it.
Yeah, I think for me, a lot of it was just that it was everything's very logical. There's a reason behind it. You can really understand why it is that you're doing things. And I think also seeing how quickly and kind of, I guess you can empower your clients as well. Like it's not just about helping them, it's also about empowering them to help themselves. So I think the combination of those things and being able to really understand things to the level that you can talk about it with your clients and they get really interested in it, how their body moves, why it moves that way. And then they get more invested in the process as well. So I think it just was very natural to kind of lead to that because it created this really kind of great teamwork almost between me and my clients as opposed to them coming in for something more passive.
Lisa, that's awesome. Why do you think that the ID correctives in particular, empower your clients?
I think a lot of it is because it really teaches them to connect with their own bodies so they can kind of check in with how they are feeling on that particular day. It's not about do this 10 times always. It's do it until you actually feel a change happen. Here is what it feels like when it's, tight or under tension. Here is what it feels like when it's not. And they kind of are able to learn those things. And I think that that's a big part of it.
Now, Lisa, there's a lot of corrective strategy courses out there, amazing ones. How do you feel like ID homework has been different for your clients? Because you're certified in everything. You're a lifelong learner, a trained anatomist. How is Immaculate Dissection for you and your clients been different than, let's say, other courses that involve, stretches, movement therapy? How's it different for you?
I think because it allows us to zero in on really what the primary cause of whatever their issue is, whether it be a movement problem or pain or dysfunction. It allows us to really zero in on what is creating that for them. So they really feel a difference in doing the correctives. And because of that, they're also more invested in doing them. So I think that's really the key for Immaculate Dissection is it shows us and really gives us that operating system of like, if we haven't, cleared this, we really can't move on to this because we'll just end up back here anyway. So I think that doing that and really being able to show clients, see how doing this really simple thing actually improves this other thing that you didn't think was related at all, and they're like, oh yeah, it did. Oh my gosh. They're like, okay, I need to be doing this all the time. Or, they are like, you know what? I've actually always had tension in my neck and, I never really thought it was related to what was going on in my hand, and I can't believe, and it was all because I was breathing wrong. Oh, that's, but because they can really see the impact of it, they really buy in. And I think because of that, they do it more often as well.
It's always amazing when you can assign a standard operating system to your clinical auditing process and follow finite rules to lead you towards finding a primary pattern. And at ID, we're very, very comfortable with that. We know that anatomy is dense, and we know that anatomy is complicated in a way, but if you study it, it creates a sense of ease and what we call ID flowcharts, where we go through a flowchart, and what Lisa's describing is like a standard operating system of prioritization. And part of our coursework, a major part of our coursework, is following that pilot's checklist of making sure. We're all very glad that the pilot checks a list before the plane takes off. And so that's what Lisa's describing, and we're very proud that she's put that into her clinical practice. How about the rest of you folks? Anyone else want to describe what immaculate dissection has done for you? And let's go to Karin Ravalese. Karin, I think you have to unmute your camera. There
With me, it's there's some people that I'm working with, but for me, it's more of a personal thing. Being involved with martial arts for years, and going involved with getting the art, trying to do the DVRT certification, RKC certification, and just kind of feeling like things were missing. More so, like I would say, with martial arts. For many years doing it, and things just maybe just weren't feeling right, like the kicks being off and just stuff like that. So it wasn't always about like trying to get strength, like, oh, just lift more weights or go heavier or just keep training harder. It was trying to understand what's actually happening and what I may be missing, and just trying to get like a clear path for that, and some good key steps and a goal. So ID has really done that for me, is opened my eyes to a whole nother way of looking at things. I'm so grateful that I found it. It's helped me immensely. I mean, it's just, I can't say enough great things about it. And like Lisa was saying too, you're always going to kind of go back to things, like it's like you're only fooling yourself if you think, oh, I'm going to do this, but it's like you're kind of going to put yourself at a little bit of a disadvantage if you don't take the time to try to understand like what's happening. Like, why can't I do this? It's not about because I'm older or I've been doing it for X amount of years and that's just par for the course, taking the sport. ID has really intensified for me personally that's not the case, that you can have anything that you want if you're willing to put the work into it, you're willing to try to understand it. And it's not just about studying the anatomy, just actually like looking at the videos, or it's about really getting down dirty with yourself, getting down there, really trying to understand what's happening, working the different, I'm going to bring ID2 into it a little bit, and obviously ID1, because they're like very, thing with the get up and the breathing and how so important that stuff is. And I think, and in myself too, in the past, I've kind of poo-pooed it myself with the breathing. I just want to work out, yada, yada, yada. But I see the benefit of it when you really try to take the time and work with yourself. It's amazing. It really is. So I'm so grateful for it, for learning this and meeting you, and just
Oh, we're very grateful to have you. I want to speak on the fact that Monica and Lisa and Kirby and I, we're all practitioners, and Karin is not yet a practitioner. She's a coach of sorts, but she actually works in a whole different field, and she's a 4th degree black belt in Taekwondo. So to watch someone who is very masterful at their athletics heal themselves down to the very basics of human movement, and watching her then as her practitioner and also as your mentor of sorts, to be able to apply those pieces and move it into your sport, and learning how to restrict yourself a bit on your sport has been really fun for me as your observer to watch, because athletes are a lot of times are told more is better, and in the great words of Brett Jones, more is not better, better is better. And the more masterful I see that someone is at their sport, the more they peel themselves back, like Karin's describing, and saying, I'm not going to tolerate anymore these words of I'm getting too old for my sport, or I'm getting too, in immaculate dissection, it's not about age or even being an athlete. It's about harmony with one's breathing, pelvic stability, moving that into the limbs, moving that up into the neck, moving it into grip, moving it into movement subsystems, moving into the peripheral neuropathies. It's extremely self-reflective, as Karin's describing. So I really like that someone as advanced of an athlete as Karin is willing to say, zero ego, zero hubris, peel all that away and say, I need to get back down to basics and get really good at the basics.
Mm-hmm. That's what we do, say that a lot in martial arts too. It's always like, oh, we got to go back to the basics. And, you know, that's a big deal with everyone, but the basics in Taekwondo are not basics. I mean, just being horse riding stance and punching and kicking and, you know, front stance and Taekwondo Pumse, that's not basic motion, even though it is basic motion, but it's really not, because there's so much that goes into building that. And it starts, you know, from the beginning.
Absolutely. Fantastic. Monica or Kirby, which one of you guys wants to go next? Monica? Okay, let's pin Monica.
Hi.
Hi, Dr. Monica.
ID's been kind of a breath of fresh air for me because, you know, in school, you're kind of learning anatomy for me, it was to get a grade. I need to pass the boards. I was like hopeful that I would remember most of it when I was done, but remembering one thing and being able to apply it are two very different things. And for me, I wasn't able to apply it in a way that I felt comfortable. So I would hit these major roadblocks with my patients, and IDs kind of completed the puzzle of, here are different tools that you have currently, and this is how you can use them with ID and when to use them. And that was huge for me. When to use the adjustment, you know, when to pull out a soft tissue tool, or when to give a stretch versus when to give something else. So that was really powerful for me as a practitioner to be able to know when to use the right tool, but also really, really great for a patient because they could do this at home. And it was simple enough that, you know, it took a couple minutes for them to just be in control of themselves.
Fantastic. Monica, can you speak a little bit more about, I really like that you talked about knowing when to use the right tools, because you, like all of this panel, have amazing tools, kettlebells and barbells and bands and chiropractic degrees and myofascial techniques and stretches and activations. How does one know that they're using the wrong tool? What has ID told you about that?
For me, it always came back to the testing. So when you can reassess the same area and there was no observable change, and it wasn't, I guess, for the, you know, as patients call it, it wasn't sticking, then it kind of set me back on this path of like, okay, I think I skipped a step. And so ID's got this perfect kind of flow chart of, this is where you start and this is where you go.
One of our big jokes in ID at any course, we say that to our newcomers or someone who has taken multiple courses with us, the dreaded words that I hear globally are, where do I start? And that is such a hard thing, to put so much money and so much personal time and so much personal effort into your patients, into yourself, and to not know where to start. So for us at ID, we wanted that to end for people. We wanted them to know exactly where to start. So we make the joke, where do I start? At the flow chart. And so at several of the IDs, at ID 1, 2, 3, 4, and 6, we have flow charts, a standard operating system that you follow, and all of them are very anatomically based. I had the great pleasure of meeting Dr. Monica in the anatomy lab when she was struggling to just make a grade to get through school or what have you, when the anatomy is not as applicable. It's not clinically oriented always. And my master's degree in anatomy is in clinical anatomy. So for me, if it's not clinically applicable, it's just minutia, right? And the truth of the matter is that most of it is clinically applicable. You just have to find out how it is. And the problem with the cadaver is that it doesn't move, right? It doesn't move. It's a static being. And although it's wonderful to appreciate, you know, human dissection, and Lisa is, you know, an expert on human dissection, it's it's just not the same as understanding how to apply the anatomy. And watching Dr. Monica go from someone who may have struggled like I did with just basic anatomy coursework, but having watched her become exemplary and being able to take anybody off the street, put her in her office, and her clinical auditing process is so on point that she will get results for that person with this amazing guaranteed feeling, because it's not a gut feeling. It is a flow chart. It is a standard operating system. It is a clinical auditing process with anatomic basis. And I've had a lot of great pleasure watching all four of the people on this panel grow as they've learned more and more ID and applied it. And they're better than they were before. Their return on investment was quite huge. So how about you, Dr. Kirby? We haven't heard from you yet. Let me pin your video. I think you may be on mute. Hold on. How about that?
Okay. Can you hear me now?
How's it going, Dr. Kirby?
Hey, doing good. How are you?
Great.
Glad to see everybody.
We're so glad to see you too.
Now, ID for me has changed my whole practice. I know you and I have talked about it ad nauseum, Kathy. You know, with some of the other techniques and skills that I've taken, invest in those, still understand. And going back and taking ID has allowed me to not only understand the technique, but to also sharpen those techniques. And when to use them and when not to use them is just as important.
Yes.
You know, the standard operating system flow chart has been unbelievable because, you know, I actually have them up in the rooms, and so patients will look at them. Well, that helps them understand where we're coming from, all of us, if we're trying to help them. They really enjoy the awareness of it. And they start having their questions, in the office, and why we do these things. All of a sudden, they become more invested, and their curiosity spikes.
Yes.
Which has been wonderful.
That's so important to have a patient be interested, a client be interested in what you're doing. And I think all of us can agree from ID. I love, Kirby, that you put the flow charts up. It's so great that they can see that you have a pilot's checklist, you have a standard operating system, you have a reason why you're doing something, and that you're seeing them as a puzzle that you would like to help them solve. It's not just about you know, something plucking out of your mind that they can't relate to. You get them excited about their care. You get them involved in that empowerment that Lisa was talking about. And it completely changes everything.
Absolutely. And what's really neat is it really shows them that you care about them.
Yes.
You know, so
Absolutely.
you're talking about them, not you, not your practice, but it's about them. And I think that's so important for the patient to really understand the passion that we all have in our ID team, and but also just that it's all about the patient. So it's pretty neat for them to become more invested and body aware of what it is.
Absolutely. I think that one of the most powerful things in the current climate of clinical rehabilitation is the discussion on evidence-based practice. And peer-reviewed support is a part of it. And then this empirical experience of a really powerful clinical auditing process is a crucial piece. And then also the patient expected outcome. If you can start to educate your client, really educate your patient to understand why you do what you do, and put that into work, it changes the dynamic of the patient interaction, client interaction, and the empowerment is huge. And so if 1/3 of all evidence-based medicine is patient expected outcome, and another third of it is your empirical data of your experience, ID brings your experience up to the next level, really encourages a great amount of commitment to that patient, not only through things that you've read, but things that you've experienced as being successful as the clinical practitioner or trainer, and then also what the patient can expect out of this outcome. And if you have a flow chart, a standard operating system, patient expectation goes up, which is going to enhance that benefit of what they're about to obtain from the corrective strategy. Well, you guys have all been so open and amazing and awesome about it. I'd like to hear more about the struggle, because I know that anatomy is hard, and I don't make a quest to make it easier. I make a quest to make it more interesting to study and more fascinating to study. I can't make it easier. I can't make it easier for anybody. I wish that I could, in a way, but I think that through the struggle of studying anatomy in a way that is clinical, is that you do get this immediate benefit from understanding the anatomy in the clinical sense, because you apply it and it works. And to me, that has changed everything about the way that I study anatomy. Because when I would just study it for studying charts and memorizing things, it didn't stick. And it didn't stick for my students either on the university medical level. And when you make it applicable, it changes everything. So I'd like for you guys to talk a little bit about your struggle. People know about mine, the fact that anatomy was my worst board score, the fact that I have always found it to be the most difficult topic. And to me, to be considered an expert in it is a great honor and privilege, and really inspires me to study. But people out there are having a really hard time studying anatomy and making it applicable in their clinical auditing process. So I'd like for one of you guys to speak about your struggle a little bit more, and how ID has helped you with your personal struggle. Monica, let me pin you. Monica, it's your show.
So when I met you, actually, and I had the worst board score in anatomy as well, I remember you sitting me down and saying, "So did I. What's the big deal? Just study."
Yes.
You have to learn to study in a way that makes it applicable for you. And I think ID, although the material is challenging to kind of wrap your head around, because now we're going from like what we've learned in 2D to like real life. And to be able to take that material, and it applies to any learning style. We had talked about this yesterday. You guys have created a course that applies to every single learning style. So regardless of the struggle, there's a way to get through it if you just keep putting your effort into it and your focus into it. For me, getting through the struggle, I had to apply to myself. So learning how to move in the same ways that I was expecting my patients to go home and do. I remember in the beginning, I was just prescribing these things to them, and I was like, this isn't working. Why can't I explain it to them? Oh, because I can't do it.
Aha.
So learning how to then apply it to myself and making sure, are my ID cues in check? Like, am I actually doing this? What's my breathing like? What's my movement like?
Oh, Monica, that's excellent, because I think that so many times that we say, oh, I heard that Stu McGill recommends the side plank and the bird dog, and therefore I'm going to apply that. And then if you're not moving well and you're on bird dog and you're trying to, teach someone how to do it, then there's a real big problem. And one of the first things we do at ID courses is we assign people partners to work with. And we want them the entire weekend to work with the same partner in an attempt to try to explain one person, and then also to reflect on oneself. And that way they're not split trying to, trade partners all the time and trying to understand new people. In fact, we just want to see, can you figure out one person? Can you really just see through the ID lens for a weekend and apply it to one person? It takes the pressure off, I think, in a huge way. But also you leave having figured out one person. Mm-hmm. And maybe two, maybe yourself as well. And I'm not going to hide the fact that ID exists from all my eminent failures. I'm very proud of my failures, because if not for them, I don't think that ID would exist, at least would I contribute to it. And I think Anna and Danny could agree to that as well. That as we keep getting better, the course keeps getting better. As we keep understanding our pendulums and our standard operating system of movement, we can demonstrate it better, and you can actually watch us grow on the online course content. You can watch me go from being very poor at my movement in the beginning compared to now, where it's more exemplary. And because you see us apply it to ourselves, like Monica's describing. So that's a really big piece. Anybody else want to talk about their failures and how ID has helped them to overcome them? Karin, let's pin you. Okay. That's on me, Karin. There you go.
You know, a lot of the same things that Monica was saying too is, you know, I obviously didn't have the anatomy board score because I'm not a doctor like the both of you, but same type of thing. You know, I said to myself, if I'm going to be able to, you know, show someone this or help someone, I need to be able to do it myself too. You know, understand what's going on. You know, the studying and struggling, you know, sometimes myself with it. You know, you see it and you're like, oh, wow, like that. Oh, that looks cool. You know, I think I can do that. And then when you do it, you're like, okay, everything else is moving. And, you know, because you always have to create the fixed point and the mobile point and, you know, really trying to understand that. And, you know, it's really, I think that you guys do an awesome job trying to make it I hate to say the word easy, but make it is palpable for everyone. I mean, it's just not easy material. I don't think anything worth having is easy. I don't. It's just not going to happen. You can't. No one can buy their way out of this. You know, it's just good old-fashioned hard work. Put the effort in it. If you believe in it, like I believed in it. You know, so I kept just working it and struggling through it. Of course, I was going to struggle. It was something new. For me, I didn't even think of it in this aspect. So that there was a struggle in it, but I don't even really look at it as a struggle, because that's what needs to happen, right? I mean,
well, you've ponied up. I've seen few people in my career as a manual therapist work as hard as Karin does, and that's why we really wanted her to be on the teaching team, and practically bullied her into it. Because she's.
I have to bully. I was who would even ask.
I wouldn't call it bullying, just hard encouragement for all of these folks. The thing that is so important to us in ID is it's anatomy and ID coursework is simple. There's a standard operating system that fits on one sheet of paper. Okay, it's simple. It's not easy, and I do agree with the fact that I want people to work smart and hard. One of my least favorite adages is work smart, not hard. No, work smart and hard. And by working at something, you can rebuild these pathways in the brain away from dysfunctional movement patterning. And I think that is a huge piece to understand, is that your brain is plastic. It is malleable. And if you think you can or you think you can't, you're right. Henry Ford, right? Like, this is a really important concept. If you're willing to accept the things that you can change, accept them and work, but have a standard operating system that is anatomically based, that is no fuss, that it's if you just execute it, it works. And one of the great feedbacks I get from my patients is, Kathy, I really loved this visit because I have structure. I know what to do now. You told me I need to do these things in this order. I need to do them this many times, or until this tension drops. I need to do this, and I need to do it whenever I start to feel discomfort or tightness arise. And if I can do it preventatively before I even feel anything, it's even better. It's icing on the proverbial rehab cake. And so it is difficult work. It's always difficult work to change the pathway. The brain can be a little lazy and say, oh, is energy efficient for me to fall into this faulty pattern because I know this pattern? It takes energy to rebuild a new neural pathway. And so therein lies the difficulty of not only learning anatomy in a functional way, but also applying it in a functional way. Anybody else want to share about their struggles? Lisa, let's pin you up.
Yeah, so I think it's interesting because anatomy was something I always really enjoyed. I didn't necessarily excel at it. I'm not like a great memorizer. That is certainly not my skill. So as much as I loved it, it was the application was what allowed me to understand it. And I think in taking immaculate dissection, it kind of tied together a few of the other things that I had taken, and it kind of allowed me to apply everything better because I had that better understanding of how the anatomy applied to movement. A lot of the stuff that we talked about in physio school didn't take it to the same level. We still talked about it in a very 2D way. And I think at Immaculate Dissection, like really understanding the 3D nature of what's happening and why it's happening and why we need to think about it happening that way, really helped me kind of push through some of the things that I had been getting stuck with in that application process. So I think for me, that was really the big thing, was just tying together a lot of like links that were there and I understood, but I didn't understand how to integrate everything. So I think it just really allowed me to integrate that anatomy into movement analysis, into exercise correctives, into treatment and clinical stuff.
Love it. That's fantastic. So I want to end this with the one thing that you would give as far as a piece of advice for someone before they sign up for an ID course, like what you would tell them to get the most out of their experience. Because our courses are all recorded. They're all available online or they're available in person. If you sign up for the in-person courses, you automatically get access to the online coursework, which is basically the recorded class. But if you are not available to come to an in-person course, we want to be able to offer the materials to you by following the online coursework. So you can go back and study this as many times as you want. We have all the materials available to you for online as far as the Vimeos to be able to study. But before someone signs up for either an online or in-person course, the one big piece of advice you would give them? Let me just pin Lisa.
I would say not to get bogged down in the details. A lot of people can get really overwhelmed, and that's definitely myself. Is like, this attaches to that and then to there, and it does this and it does that, but when it's over here, it does this. Just don't worry about that stuff and just try to practice the things and sort of think about the big things that are being said and practice those. The detailed stuff can always come later as you better understand everything else. Just try to take away the big picture items. And then, like Kathy said, you can go back and rewatch. I've watched every course probably like, I don't even know how many times. I like, you know, in helping teach, but also I usually rewatch the course before I go help teach a course. So I'm not sure how many times I've seen them all, but you pick up little things each time you see the information. So I would say focus on the big stuff, focus on the operating systems, focus on, you know, learning those skills. And that's just, don't worry about the little details. That stuff can come up with time.
I love it. So they're not being quizzed, right? I'm not going to quiz you on the origin insertion of everything. The whole point of learning origin insertion is just to basically talk about fixed points and moving points and how something moves in space. And so fortunately, a lot of people come into the course already with that. If you don't come to our course with that, if this is the first anatomy class you've ever taken, you're not going to be behind other people because the way that we analyze anatomy is so different. And I think that anybody could come in with that. I think that's a wonderful piece of advice from Lisa, to not let oneself get inundated with the details and really follow, where do I start at the flow chart, and follow the big pieces. Anyone else have a great piece of advice for newcomers? Is that Kirby? Okay, let's pin you up. Kirby, let me unmute you. There you go.
Hey, yeah, you know, what I would tell people is get ready to have fun. Because you're gonna get a lot of information, but it's kind of like Lisa said, you know, we're gonna break it down in compartments. You got your flow chart, but it can actually make it more fun. Is it a struggle? Sure, but your failure, it's what you do with our failures that lead to success.
Love it.
So just take it one step at a time and realize that if you base it on that flow chart, like Lisa was saying, not get bogged down in the details, but enjoy every minute, because you're going to hear it, you're going to see it with the artwork, and then, you know, you're going to have time to practice it. Obviously, when you come to our class, we're going to have that. So we're going to get every aspect of learning that you've never had before.
Wonderful. We have so much fun at ID courses that we almost get so tickled that we can barely teach. It's a terrible thing. Our power of expertise goes right out the window. We have way too much fun. There's so much laughter, and it's a safe and non-threatening learning environment. You're not there to be quizzed or tested. We're going to try to bring the fun back into functional anatomy. And we, you know, these four people on this panel are so delightful. They're not only brilliant practitioners who study so hard. You heard Lisa. She studies. I mean, I see Kirby always studying his manual before we teach. We'll be in the night before, all hanging out at dinner or something, and I'll see him in the car kind of flipping through the pages. And this is a brilliant guy. And he still studies. The difference between the master and the student is only the resistance. We are becoming very good at our ID coursework, and we all still study. We all still look at the Vimeos. We all still work hard. I watch our own Vimeos, and I'm one of your content generators. So it's so important to understand how fun opens up the pathways towards neuroplasticity. It opens up your ability to let go of things that didn't work for you and bring about something new. Love it. How about Monica or Karin? What do you guys, for your one piece of advice? Let's go to Monica.
I think the biggest piece of advice, because everyone made such really great points, is to not rush it, to really take the time to understand it. And if you're getting frustrated, take a break. Take a break and maybe move into those things that are frustrating you, because again, like I said, for me, it was not being able to connect to the material because I wasn't there. So I needed to be in it. So just don't rush it. Take your time with the material, and like Kirby said, enjoy it.
And if Monica, if someone gets kind of nervous in the class, and what advice would you give them about when they start to feel overwhelmed?
To talk to one of you guys or one of us, because I've been nervous all the time. And everyone's so great at just, like for me, it's about slowing it down. So just, where are you getting stuck, or why are you getting nervous? What's catching you? And then being able to just break down and simplify things. It's a lot of information coming at you at once. So your brain's trying to organize it as you're hearing it. But if you can kind of find little ways and ask for help, I think that's the best thing.
I love the request to ask for help, because sometimes people are stymied by the dense fog of massive information coming at them. And I'll say, hey, anybody have any questions? And they'll just be like a glaze, because they don't know how to articulate the question, or they don't want to feel stupid for asking a question. Not that we would ever make you feel that way. It's more about facing the fact that things may be a little bit difficult for you, that you may have a different learning speed compared to the person next to you, or you may have a trouble connecting to the material because it is your problem. You have trouble with joint centration for the femur, and then you can't understand joint centration. There's a reason for that. We understand what we can do well, and sometimes we falter in understanding what we can't do well. And that's more the reason to ask for help. So we have these incredible teaching team members. You also have me, Anna, Danny at every course to ask questions to. So, and you can watch these videos over and over and over if you need to. You can always go back. Just come and have fun and ask for help, and don't focus on the details. So far, all great advice. Karin, do you want to leave us with the last piece of advice for newcomers, especially from you who is not a practitioner? Do you have any advice for people that are not practitioners?
Yes, I would say just try to be as patient with yourself as possible. I know that's always a tough thing, because sometimes you're excited about the material, and it's like you want to know all these different, like, let's look at this, let's look at that. You can get yourself like so immersed and off on tangents and stuff. So just try to relax with it, and just allow yourself to learn. You're gonna get it. I mean, just stay in the game. That's all you got to do, is just stay in the game. And or just try to take like a piece of something, maybe study the obliques one day or something, and then try to figure out how they coordinate with the upper body and the lower body. Just try to make sense of it. How does the system work? And you'll just learn. You'll find your own learning style too. You'll get frustrated, but you'll figure it out. It's just be patient, and just go with the flow. Just stay in the game. Just study something every day, even if it's for 10 minutes.
I love that idea. I love the consistent commitment. What you do consistently is going to show. And if you are taking 5-10 minutes per day on application of ID concepts, after a year, you put in 365 days of a 5 to 10 minute commitment, that is an enormous amount of study. It really is. And I love seeing pictures of like Karin or Lisa or one of our amazing attendees sent me a picture of her watching the Vimeos while she was doing laundry. And her husband came through and was like, "Is that Kathy Dooley again?" I was like, "Oh," he's like, "I feel like I'm married to Kathy Dooley." I like was in tears when she told me that, because it was partly joy and partly humorous. She's dedicating herself, and she's got a family to run. She's got a job to do, but she's still committing time to learning, which is so beautiful for herself and for her clients. So we want to let you know that all of these amazing people are usually at either domestic or courses in Canada. These incredible people are also willing to answer your questions. If you feel like, hey, I don't want to hear what Dooley has to say, I want to hear what they have to say, I'm going to include, with their permission, their emails in this post so that you can reach out to them. And I'm pretty sure they're all going to say yes to me right now. But if not, you guys will let me know. These are warm, wonderful people. If you decide to take an ID course with us, we have ID 1, 2, 3, 4, 5, and 6. 1 is core concepts, 2 is lower extremity, 3 is upper extremity, 4 is neck, jaw, hand grip concepts, 5 peripheral nerve concepts, and then 6 is anatomy and movement subsystems. They're all available online or in person. If you buy the in-person course, you can also get the online access as part of it. In-person courses, they range from $500 to $600 depending on early bird or domestic application versus international. And then all online courses are $300 USD. If you buy an online course, you can also apply that tuition to an in-person course. So you don't lose out by getting the online access. We never want you to feel like you've lost out on anything. So if you decide, hey, I'm going to start with core concept, I'm going to invest my $300, and then later on I want to take it in person with Dr. Monica because she's incredible, or Dr. Lisa because I really resonate with what she had to say, or Dr. Kirby or Karin, then you can apply that $300 that you spent to an in-person course. So it's we try to create an environment where we want your tuition to really be of value to you. We want to give you as much as we can for your tuition. And to us, it's a life force. We really want you to understand anatomy and apply it to all the skill sets you currently have to make you sharper and better, like Kirby said, at your current skill set. We're not asking you to throw away any of your skills. We're asking you to enhance them and sharpen them with anatomy, with a great understanding of it. And we think ID might be that choice for you. Hopefully you can join us at an ID course soon, either online or in person. Thank you folks so much, so much. We can't tell you how much we appreciate you as being a part of the ID family. Thank you folks.
Thank you.
Thank you.
Thank you.
And we hope to see you guys either online on the forums for ID. We also have discussion boards where people can ask questions. We want to make sure that you're cared for, or an in-person course if you decide to do it in person with us. Thank you guys all for watching or listening, and I hope you have a wonderful, wonderful year, and we hope to see you soon in an ID course.